There are two issues with skin cancer. One, obviously, as most people are aware, is the concern about sun exposure. And so patients that have an excessive sun exposure are at heightened risk for both squamous cell and basal cell carcinoma. Melanoma is a little bit more complicated in the sense that there's a clear genetic component as well as sun exposure component. Melanoma is very uncommon in the African American population. And when it does occur, it is going to be more frequently a melanoma involving the palms of the hand or the soles of the feet, so-called acral lentiginous melanoma. And the very famous reggae singer Bob Marley actually died from a melanoma. The prototypical patient for a melanoma risk is the blue-eyed blonde, or particularly the red-headed blue-eyed patient. Those folks from Scandinavian origin, people like me that have a British background, Germanic background, so that they're at much higher risk. What I tell patients is any new mole or lesion, skin lesion that is changing, getting bigger, bleeding, itching, all of those things are worrisome signs. The very first step is really, if you think you have something that you're concerned about, is to consult either a dermatologist most frequently or a surgeon. That individual will most likely, if the lesion is concerning to them, biopsy it. The material is then sent to the pathologist for analysis. The first treatment of choice is unequivocally surgery, and that entails a wide excision and more often than not an examination of the draining lymph nodes to find out if the cancer has spread. When the disease is advanced, the prognosis actually can be quite alarming and not favorable at all. However, when it's diagnosed early, one can anticipate a high rate of cure with appropriate treatment.